Good afternoon, everyone, and thanks for joining us. I'm Marcel Vanderweer, editor of OHS Canada. Today's webinar, Applied Safety and Risk Management, will unpack lessons in managing emerging issues through a global pandemic. With that, I'd like to introduce our moderator for today, Dylan Short. Dylan is the managing director of the Redlands Group, a boutique management consulting firm in Oakville, Ontario, focusing on incorporating safety, health, and risk management principles into organizational practices. Dylan is also a valued member of OHS Canada's editorial board. Over to you, Dylan.
Thank you very much, Marcel, and really appreciate everybody joining us here this afternoon. 2020 has really been the type of year that we thought we only learned about in history books. Hospitals reaching capacity, emergency public health measures, personal protective equipment shortages, not to mention the great toilet paper shortage of 2020 has really been quite the year. All these things are from an age when our grandparents in 1918 had to deal with things like the cost of a stamp being 3 cents, and the USA making the grand progressive move to be able to choose to adopt time zones. It was definitely a different time. Now our conversations have changed. Social distancing, being asymptomatic, transmissibility, community spread, case rate, positivity rate, super spreader events, flatten the curve, and the one that I'm absolutely most jealous about is the Atlantic bubble. These are all the terminology, the things that epidemiologists have become the language of our daily Zoom meetings, of our news feeds, and even of our politicians. But what have we learned? Well, at the end of the day, we've learned a number of things like how to wash our hands, how to keep your distance, don't touch your face, where to find the really good hand sanitizer, but it goes well beyond that. Today, I'd like to introduce you to our panel of experts, and we're going to have a conversation about lessons learned in managing workplace safety during a global pandemic. So joining me today, first I want to introduce you to Manisha Ministry. She's the Senior Director of Health Safety, Environment and Change Management at CSA Group. She oversees CSA's global health, safety, and management systems, where she leads a team of health and safety professionals addressing HSE challenges within their operations based in Canada, US, and across Europe. Also next is Liz Horvath. Liz is the Manager of Workplace Mental Health and Opening Minds at the Mental Health Commission of Canada. She currently leads the Open Minds Workplace Mental Health Program at the Mental Health Commission of Canada. Opening Minds provides support for organizations seeking to implement effective, evidence-based mental health strategies and training that align with the National Standard of Canada on the Psychological Health and Safety in the Workplace Standard. Finally, I'd like to introduce you to Dan Black. Dan is a lawyer in association with Carbell Law. Dan has been practicing health and safety and employment law in Ontario for 25 years. His experience in health and safety matters includes advising employers on both basic and advanced regulatory compliance, including duties of employers, supervisors, workers, and other workplace parties. So welcome, and thank you for the three of you for joining us today.
Thank you.
So I wanted to start our conversation off first with a question for you, Manisha. CSA Group has a large number of different jobs that employees do within your organization, being a very large organization, as mentioned, being global. What's been the most challenging adjustment that CSA has had to make since the start of the pandemic?
It's a great question. I think, we began this right at the beginning. We have operations in China. So once we started, we were very keen on understanding the lessons that they were learning very quickly. The biggest challenge has been, as an organization that's global, we have 2,000 employees globally, but still a wide footprint, is keeping up to date with the changing information, and then making sure that we had the infrastructure to ramp up as well as stage down where we need to. The biggest thing for us, and to your point, is having a variety of jobs across the organization. It was very quickly, easily took our working from home workforce, and that's probably almost 80 to 90% of our workforce, and took them out of the picture and then focused on our on-site operations as it related to testing activities on site and our employees in the field. So I think the biggest challenge for us has been is how do you control the environments that we don't control. So putting people into the field, and we know what our policies and our protocols are, and we're confident with them, but putting an employee out in the field and going to a customer's location, and making sure that we were sending them out into a relatively safe environment as well.
Sounds like a real challenge over time. So Liz, with Manisha talking about working remotely, and for a lot of organizations, working remotely, especially on this scale, is really very new. So while working remotely and balancing family is causing a lot of challenges for people about staying focused, meeting personal and professional goals, expectations, what kind of tools or ideas have you found to be able to help adjust to working remotely, especially as we enter into holiday season, into the winter season here across Canada?
Yeah, thank you, Dylan. It's a question that we really started to grapple at the beginning of the pandemic as we saw the effects that it was having on people. Just like Manisha said, you've got people working from home, but you've also got people working out in the field, and that aspect around how do you deal with the isolation when people are working at home was one of the things that we provided some resources on, but also those conversations that managers and employers need to have with their employees around flexibility, around how do you deal with the isolation, around how do you find credible information and know that the information that you're looking at is credible. How do you help somebody get set up within their work at home environment so that they have the best ergonomics, especially when they may be working in a situation where they're not able to have a good ergonomic setup. So these are all some of the kinds of questions that were coming to us when we saw the pandemic kind of unfolding. And so the Mental Health Commission quickly put together a resource hub that you can access, and there's a list of COVID resources. If you look at the handouts there, you can download those some of the resources that are listed in the COVID hub. But what we found was that providing tips, for example, on, well, what does flexibility and empathy mean? So when you're talking to employees about the pandemic is adding additional pressure onto people, whether they're having to go out and do shopping and stand in lines, or you're having to try and figure out how do I work at home with my children and my spouse or other people in the home, or I'm having to go out and take care of perhaps my elderly parents who need more help, especially during this time. So one of the things is how to have those conversations around flexibility. Having a conversation and letting people know that, okay, it's important to be flexible, we're going to provide flexibility for you, but then not defining what that actually looks like and means can have the wrong impact. Even though the intent is there to be flexible, what ends up coming across sometimes is, okay, so I can have enough flexibility to do my work whenever it needs to be done. So I'm going to be now expected to work until 2 a.m. So we don't want people to be thinking that. So what we did was we put together a resource called Guidelines for Building Mental Health into Operations During a Pandemic. And you can download that from the website. And it provides access to a lot of the thinking that needs to go behind, how do I help my workers through this? How does the additional stress of a pandemic affect an employee's ability to think and focus? And what are some of the supports and resources that you can provide to employees? So for example, we've gone through and identified resources in areas of clear leadership and expectations. What are the kinds of questions that you should be asking, and what are the kinds of supports that you should be giving? Protection of physical safety. So we know that the physical work environment has a direct impact on the psychological health of the person. So looking at what the physical workplace, what the setup is like, not only from an ergonomics point of view, but also from exposure to the potential virus and the other, the interactions within the work environment. What psychological and social support does a person need to have? And what does that look like? The support both from the employer, so maybe through benefits and EAP, but also out there in the community. So for example, providing people with information about community supports such as Wellness Together Canada, where they can get access to free counseling online without even having to leave their home or their office. And also information about psychological protection and workload management. So these are all the kinds of tools that are really helpful for people.
That's an awful lot to be able to go through and deal with. I'm glad that you already pointed out some of our resources that are on the list as well. Dan, for you, and because I know that you advise a variety of different employers, what's been the biggest challenges, whether it's working remotely or otherwise in COVID so far?
I think that probably is the biggest challenge that my clients have faced is sorting out how to make it possible for employees to work from home and then how to support them in doing that. One of the questions that I get most often from my clients is, am I responsible for the health and safety of my employees when they're working at home? That's their home. Isn't that their problem? And along with that, they're working at their kitchen tables, or they're working perched on the corner of something, or laying on their bed sometimes with their computers in their laps. Some of them are asking me, I need a desk, I need a chair, I need a bigger monitor, I need this, I need that. Do you have to provide those things to them? And part of the problem here is that there aren't clear legal obligations in terms of what an employer must pay for. For example, if the employee has a suitable workstation, terrific. If they don't have a suitable workstation, do I as the employer have to provide them with that? Do I have to buy a desk and a comfortable chair? If they're complaining about sitting on the kitchen table, working at the kitchen table and on that chair. And the answer, again, is a gray zone. There's no clear obligation to provide your employees with that equipment, but it's also clear that you are responsible for their safety when they're working in their homes. Certainly in Ontario, the Ontario Court of Appeal was clear a few years ago that wherever a worker works is the workplace. And so if you've assigned or permitted your employees to work from their home, you as their employer do have an obligation to make sure that they're safe there. Now, presumably people aren't assembling cars and things in their homes. We're talking people that are doing more office type work. And so what we are talking about is primarily ergonomic things. So what I've been telling my clients is provide some clear guidance. You don't necessarily have to, buy a chair and a desk and a table and a lamp and all that for your employees, but give them some clear guidance as to how to work safely at home. So at least you've given them some instruction. So that's probably the number one thing, is just the mechanics of, how do we get people working from home safely?
You had a comment, Manisha?
Yeah, absolutely.
No.
When we first initially went offline with the majority of our staff, it was how do you give them all the resources that they need right up front, making sure that they understand the complexities around being safe now in a home environment. Most recently, we put out a home office assessment tool to our workforce, which allowed our employees to kind of go through what they needed to do to set up. And where there was, some opportunities, we worked with them to maybe facilitate picking up their chair from the office, taking home a monitor, all of those things. And then the quick wins, like giving our employees headsets where they needed them. So those, I think, those very tangible things for employees then gave them greater understanding of the fact that in the end of the day, they were working for us when they were working from home.
And I think another part of it is sorry, Dylan, I was going to say another part of it is encouraging employees to have a clear demarcation between when you're working and when you're not working. And that's important from a health and safety perspective. It's important from other legal angles as well, including responsibility if the worker, if an employee does get injured at home. If I duck down for half an hour to vacuum my car or wash my car in the driveway, that shouldn't be work related if I'm injured. But if I ducked out to the washroom or down to the kitchen to grab myself a glass of water, the lines become a little more blurred. And so when you're dealing with, well, am I responsible as the employer for this injury, both from a health and safety perspective and from a workers' compensation perspective, perhaps, how did it happen? And so again, I think if you give your employees very clear guidelines about, you should have a set place where you conduct your work. It should be, as to the extent you can, sort of quiet, separate place to work. And you should try and have set hours, just like in the office. You don't wander off to vacuum your car from the office, so don't do that sort of thing at home. So sit at your desk at a certain time, work until a certain time, take a break, much of the same structure you would have if you were working at the workplace. And that helps to create clear guidelines from both those perspectives.
Absolutely, and it's interesting because I've had conversations with a number of our clients recently, and what you see in the media is a lot of discussion about, are we going to get productivity levels that are necessary? And what a lot of our clients are seeing is they're having difficulties with individuals who are having difficulty turning off. So having that clear demarcation is important. Physical space, schedules, those kinds of things. Liz, you had a comment as well?
Yeah, I was just going to say that, having that structure around your physical workspace, and also the structure around the timing, like you said, Dan, is also helpful for mental health as well, because when we're in the workplace, we have a fairly structured schedule that we're following usually. When things are kind of turned upside down, it's important to reestablish that structure so that we know, the boundaries of what it is that we're working on, the boundaries within which we're working, and also that it is okay to shut down at certain times, and it is okay to take those breaks, and it is okay to take that flexibility, but within a structure. That structure helps our brain to know that things, even though we're dealing with all of this uncertainty, there's some certainty that we're able to follow. So it is helpful.
It really is helpful to have that structure. So Manisha, we've talked a lot here in this piece a little bit about remote work, but how have you as an organization really helped to manage, because not all work can be done remotely. There's a lot of work that, in your organization requires people to attend to an office or attend to even a third party's facility to be able to do the various testing, the inspections, the reviews that are needed to be done. So what are some of the things that CSA and you have done to be able to help to manage some of that process?
Yeah, at the beginning, we pulled together globally, and we came up with a global COVID control measures protocol. Really gave the entire organization essentially a framework to start making sure that we were approaching COVID the same way across the globe as it related to our operations. Taking our remote workers and taking them out to work from home was easy. And then, as you say, focusing on the folks that have to actually test in the lab environment or go visit a customer, we realized we had to put in infrastructure there that allowed us to understand what they were doing in the field when they were visiting a customer. Now we have a process where all of those activities has to be conducted through a travel request. So a job is opened, a job then follows a thorough HSSE review, and then goes to RVPs for approval before anybody can do anything. So globally, we've worked with our leadership team to understand what's permitted and what's not allowed. For those that are in the lab environments, we've created very clear expectations about, who works in what areas, essentially work bubbles, right? This is where an employee works. This is the washroom that they use. This is the lunchroom that they use. So that should we be in a situation, we can contain that very quickly. It's been important for us to be very transparent with the employees and what our intentions were and what we needed from them, right? Because we can put in all the protocols and procedures in place, but we also needed them to feel comfortable with the actions that we were taking and be part and parcel of that process.
Excellent. So and putting those processes in place has been no doubt evolving, as our knowledge about this novel coronavirus has evolved as well. And Dan, for you, one of the things that we've run into questions a fair amount about is around those in-person workplaces and some of the challenges and a number of areas where people are asked to symptom check. Other individuals are going beyond symptom check and actually doing temperature checks and these kinds of things. So around these kinds of processes, are there any privacy considerations that employers should really be taking into account when they're doing these things?
Yeah, for sure. Absolutely. Just as with any health information about an employee, if you know an employee has a health condition, that's personal health information. In Ontario, you've got the Personal Health Information Protection Act that governs the collection, use, and disclosure of personal health information, including in the workplace. You've got similar legislation in other jurisdictions as well. The good news is that really, if you're an employer who's familiar with those privacy obligations pre-COVID, they're not really that different in respect of COVID. So if I know that one of my employees has tested positive or has been exposed or has a family member who's tested positive, that's personal health information about my employee. And so I don't have an automatic right to just disclose that. So for example, one question that comes up a lot is, Dan has tested positive. What do we tell Dan's coworkers? Well, you don't necessarily have the right to say, guess what, everybody, Dan tested positive. Anybody who was working with him better go get checked. Now, depending on the nature of the workplace and who works with whom, of course, it may be obvious. You say one of our workers has tested positive. Those of you who have been working in this area of the workplace need to go and get tested or ought to go and get tested. Well, everybody may be able to put two and two together and say, well, obviously it's Dan. But basically the same principles apply. I've learned something about the health of one of my employees. I disclose it only in accordance with the employee's consent, if you get that, or with a permitted disclosure in the same way that I would with any other health information about an employee.
It does make for an added layer of complexity for employers, especially that aren't used to handling personal health information. So that's that's some sound advice to be able to look at. With those,
sorry, I was just going to say.
Sorry, go ahead.
That it's not unusual for employers to have health information about one or two or three or a handful of employees, but now you're getting health information about every one of your employees.
Yeah. So Liz, with those things that are happening, having a positive test in a workplace doesn't just affect the individual who's tested positive or even potentially tested positive, because we're seeing at times that we're having false positives in workplaces as well. What are the things that you're advising organizations to do to not just, obviously we take care of the individual who has the positive test, but the rest of the workplace and how that affects our work in the physical world?
Yeah, the stress and anxiety that's kind of come along with this pandemic, we're seeing increases in anxiety, we're seeing potential increases in depression. Definitely people are having more concern over their mental health. And when people are having to go into the workplace and be around other people, not just in their home bubble, but now they're in, as Manisha put it, their work bubbles too. Some people just don't want to go into a physical workplace because of fears. And some people are having to go to work because they don't have a choice. And so, having those conversations, being very open and transparent in explaining, here's what we're doing to protect you, here's what to do in the case of someone who has been exposed. And making sure that you've got the time and space to be able to have those open conversations, but have them using the right language too. So understanding that there is increased fear and anxiety, talking about your own levels of what your concerns are, and especially leadership. When leadership is very transparent and open about their own feelings around the pandemic, and around even being in the workplace, that helps other people understand that they're not alone in those feelings. And also being able to set up those safe spaces for people to be able to have private conversations as well. So it's not necessarily saying let's have a group conversation, but some people may want to express their concerns directly to their manager, or perhaps directly to a coworker or a peer supporter. So those safe spaces are really important. And we also have to remember that we are also dealing with a population where even before the pandemic, nearly a quarter of people have or live with mental health conditions. So understanding that there's an impact to people who have mental health conditions when they're being exposed to a workplace where they may be exposed to something like this COVID-19, or the other effects of all the cleaning and the decontamination and the wearing of masks and just the whole way that the physical work environment is affecting people. So have those safe spaces, know what you're going to be talking with them about, know how to explain what's being done to protect them and how their privacy and confidentiality will be protected in the case of an exposure. One of the other things that we're seeing is people being afraid to actually talk about the fact that they may have a symptom. You know, oh, I'm afraid to cough in the workplace. I'm afraid to sneeze. I'm afraid to have any symptoms, or even say that I have a symptom, because they might be having to stay at home. But you have to follow the rules of the workplace and what those rules are. So being compassionate and having some sort of contingency planning in place if your workers are having to take some time off is also going to help with the workload aspect of things.
So Manisha, is there anything else that you've done at CSA to help those individuals who do have to return to the physical labs or to customer locations? You know, other strategies that you might have used in your organization to help with that assistance and getting over some of the fear, the apprehension, and what else is going on?
Yeah, we've been very lucky. I will tell you, I think most successful organizations that are going to get through this on the other side, with a different lens of their organization, is the ones where the leadership has really shown that the value of health and safety is the most important priority for the organization. And we've been absolutely lucky. You know, speaking as an HSE professional, I couldn't have asked to work at another organization right now. Being able to work alongside our senior executives, making decisions together that are right for our employees has been critical. We have weekly communications from our CEO and president, which really has helped in particular, I think our essential employees really understand how decisions are being made. And the feeling of, you know, we understand if you are hesitating, and let us know, right? And we'll work with you. And we don't want to be putting, you know, people into positions where, you know, they're really struggling with what they're doing on a day-to-day basis. But we have, you know, we're really lucky to have a really great workforce who comes to the table, you know, being transparent about what our plans are, and then having their feedback and taking that into consideration has been critical for us.
Absolutely, and it's I know early on one of the things that I was getting feedback from the various regulators was that they were dealing with as many work refusals daily as they would normally in half a year. So to you, Dan, is there anything that else from the legal perspective around trying to manage a work refusal that you've been advising any of your employers about, and any of the process or any of those kinds of things that you've come up with that are more often an issue or trying to avert issues, I guess?
For sure. I mean, one thing I've been telling a lot of my clients is try and take a long-term view here. So from a sort of an employer-employee long-term relationship compassion perspective, you're going to have employees who don't really have a valid excuse not to report to work, but they're afraid to come to work, whether it's because of the mechanism by which they get to work on public transit, or whether it's coming into the workplace. They may not have a legitimate legal basis to refuse to come in. And theoretically, you could discipline them for it. You could terminate their employment. But I've been saying, take a longer term view. This isn't forever, we hope. And so try and work with the employees. So do some of the things that we've already been talking about here in terms of educating your employees. Let them know that you're aware of what the risks are. Let them know that you're keeping up to date on what the public health and other recommendations are. Be clear in your communications about what is being done to protect them so that you can try and gently encourage them to come into the workplace. The other thing I've been saying is be careful. If you want to go down the road of discipline or termination, you need to be careful. In Ontario, for example, employers are not allowed to request or require medical certificates from employees to prove that they need to be on infectious disease emergency leave. And so it's probably not that difficult for an employee to find some basis to justify not coming into the workplace other than just their pure fear. So if you're thinking about taking a hardline approach with your employees, move carefully and think about whether that's really in your best interest as an employer in the long term as well. And remember too that other people see what happened, other employees see what happened. So if you're disciplining somebody who's genuinely afraid to come into the workplace, their coworkers may not take that well. And then that leads us back into mental health and the crossover with human rights law, of course. The fear of coming into the workplace might just be a fear, or it might edge into something that constitutes a disability under the Human Rights Code, which would require you to accommodate the employee's disability. So as I say, move carefully and communicate carefully.
Absolutely. It's, I think it's sound advice that both of you have given in talking about the being open in communication and being very transparent about kind of processes and whatnot. Liz, in your organization, well, your organization is an organization that provides supports in mental health. You're still an organization and you're still an employee. So what are some of the things that the Mental Health Commission of Canada as an organization has done, at least from your experience, being somebody who's employed by the organization, and what is the leadership team done there that's really helped to be able to move that conversation forward?
That's an excellent point. And yes, our organization, I'm really happy to say that, our leadership really took a proactive view to this right from the beginning. We were all asked to get ready to work from home just before the World Health Organization announced this as a pandemic. So by the time that announcement came out, our entire organization was set up to work from home. It's been a difficult transition for many people. That we have a few people like myself who work remotely all the time, but for the most part, they didn't. And so there was a lot of social support there. There was a lot of, encouraging people to take their time off. The discussions around flexibility, certainly providing the safe workspaces, but also one of the things that we've also done is there's a return to office committee that has been struck. So looking at how do we look at how many people do want to come back to the workplace? Do they want to come back on a permanent basis, or do they want to come back on a blended basis, or how many people actually want to continue working from home? Because what we're also seeing is that there's some good productivity too that happens when working from home and you don't have to spend that time commuting. But also supporting people in not only in working from home, but to determine if we do bring people back into the workplace, and we have a few people who have gone back to the workplace, when's the right time to do that? How do we support them in that? What are the other aspects other than the physical workplace itself that we need to be focusing on? And so there's been a number of surveys that have gone out, conversations that have happened to determine what would make you comfortable in coming back to the workplace. And if you do continue to work from home, how can we support you in that? One of the things that I really love is that nobody's being forced to come back into the workplace. And especially with those conversations over the upcoming winter, as we're going into the holiday season and into winter throughout this pandemic, I'm hearing concerns from people in other organizations saying, well, my organization is making us come back to work in the middle of January or in the middle of February, and we don't really understand that. our leadership is not doing that. They're actually asking people when they would be comfortable coming back, and also asking what principles, what learning have we got out of this that we can apply. So things like giving people back time in their calendar is one of the new principles that we're living by, and trying to shorten our meetings and make sure to reduce that Zoom fatigue that's happening with a lot of people. So lots of great stuff that's going on, and increasing benefits and access to healthcare through Dialogue, and that's a new program called Dialogue, and just, yeah, lots of really great stuff happening.
So it sounds like they're, all three of you are finding a lot of the positives in these kinds of things. I did want to ask you, Dan, one other, because it's an area that I am seeing. We have a few clients that are saying, we don't support the work from home, and we really need to get people back in the office because we're not getting the productivity numbers and those kinds of things. And there seems to be, from our point of view, they're the same kind of employers that we're finding are struggling with their health and safety programs, are struggling with communication and various things. So in that vein, do organizations, do managers, do senior leaders, executives in organizations have liability about the decisions they're making, and and the impact that it may have on individuals over time?
Yeah, well, liability is a bit of a complicated question, but I'll start with most employers, not all, but most employers are covered by workers' compensation in Ontario and across Canada generally. And so if a worker, for example, contracts COVID, can demonstrate that it was contracted in the workplace, that's a work-related occupational illness. And so certainly in Ontario, that will be covered by workers' compensation. And the good news for employers is the costs are not being attributed to individual employer cost records, which hopefully encourages employers to err on the side of reporting. When a worker qualifies for WSIB or workers' compensation benefits, they can't sue their employer. They can't sue managers, supervisors, etc. Now, in Ontario, again, at least, executive officers of a corporation don't automatically have coverage under workers' compensation. So at the very most senior levels, sort of directing minds type level, potentially there is exposure to liability. The worker could theoretically sue an executive of the corporation saying, your negligence in failing to take proper precautions in my workplace led to me contracting the disease. But at the same time, the whole reason why workers' compensation exists is because it's very, very difficult for an employee to sue their employer and prove negligence. And particularly with something like this, where the employer will no doubt have defenses, or their lawyer will come up with defenses, say, well, how do you know you didn't get it at the grocery store? One of your kids brought it home, et cetera, et cetera. So liability is a possibility. And I suppose if we have situations like we've seen in meatpacking plants and things where you have literally dozens or hundreds of employees contracting it, you might see a class action lawsuit trying to work its way before the court, something like that. So it's not an impossibility, but for the most part, particularly managers and supervisors, as long as you're registered and required to be covered for workers' compensation, the exposure should be relatively low. Ontario, by the way, has also introduced a new law that is intended to limit liability for COVID-19 transmission. Now, it doesn't cover workplace situations. So if you're in an employment situation and contract it, your employer is not off the hook because of that. And similarly, if you have customers coming in, if you're a retail or something like that, or a restaurant, you have customers coming in and contracted, that's where you are exposed. And so anybody, when we're talking beyond just the employee situation, we're talking about customers and visitors who are not your own employees, there might be exposure there. All of which just points, again, to keeping up to date on what the requirements are and what the best practices are in terms of screening for employees, screening for visitors, et cetera.
Well, and some of that, I think, goes back to what you reflect on as earlier, your advice to clients. If you're making decisions about the long term, it makes decisions a little bit easier for some of these things. And that's where I know in some of our conversations, that's been the difficult portion, because a number of employers really are, they're in hard times. economically, this has been a devastating year for a lot of Canadian business, large and small. And it's making them feel like they have to push into decisions that they don't necessarily want to, but don't necessarily always feel like they have a lot of choice. So it's good to know that as long as you are moving through that, and working in good faith and those kinds of things, that you do have a reasonable level of legal protections to go with that too. So before we get to some of the questions we may have from our audience, you'll notice Marcel has just reminded people, if you do have any questions, please put them into the questions tab. So we'll get there in a couple of minutes. A couple of last questions. Manisha, kind of ask you a little bit of a different question. What's the big thing you've kind of learned about your organization through all this? Because the world's kind of really turned upside down, and we learn all kinds of interesting things, some good, some bad, I'm sure. But what's the big things that you've learned about CSA Group?
I think one of the biggest things we've learned is that we're pretty resilient as an organization, and like many organizations, we're pretty productive working remotely. We still need our on-site essential employees to keep testing and, getting out in the field and doing inspections. But we've been able to leverage remote audits, remote inspections, and that's been exciting. And being able to leverage technology, I couldn't imagine us doing what we're doing today 10 years ago. So I think most organizations who have kept up with their IT infrastructure really have come out on the other end of it. But yeah, more resilient, I think, than we thought we could be in a situation like this.
Absolutely. I'm also a volunteer with CSA Group with some of their standards and whatnot. And I can tell you that the meetings we expected to do back in March and April were a little lumpy, bumpy, and whatnot. Yeah. But things have come along, and it's amazing how I also have a greater appreciation for those who work on those various standards and always work remotely. It's a challenge, but it's amazing what you can get done when you really focus on that kind of solution mindset too. So, Elizabeth, is there anything that you want to share? Because I know you and I have been friends for a very long time, and I know your personal passion about individuals' well-being started in occupational health and safety and has really kind of evolved into the whole person. Is there anything else that I guess that you've been pleasantly surprised about that you've kind of seen come through this in 2020?
Yeah, I mean, we do see also that there's, while we're seeing increases in anxiety, and while we're trying to help protect against things like burnout and help people with how they feel going through this pandemic, we're also seeing that people really come together in times of emergencies and disasters. We know from some of the past research that this happens, and we're seeing it out there all the time. People come together, they're checking in with each other. We're seeing reports of increased resilience. We're seeing reports of increased resilience in workers' children. We're seeing people coming together to support people who are out there on the front lines, and understanding that that's not just people who are working in healthcare. People in the front lines are also those working in retail, working in transportation, working in utilities, and other services as well. So when we see also that people are having more time with their family members, more connection with people, even though some of that connection may be virtual, as we're doing now, there's this sense of really getting back to what's important in life. And there seems to be a lot of talk about, well, what is life going to look like beyond this? People are saying, I don't necessarily want to go back to what normal was, because normal is what led to a lot of the issues that we're dealing with. So seeing that there's so much innovation in how people are dealing with it, and so much more resilience coming about, I think that these are some of the things that the camaraderie, that lifting in the human spirit, that warms my heart.
Awesome. Dan, is from your point of view, we've talked a lot about kind of the technical or some of the transactional legal components. Is there kind of a high level advice that you're giving your clients that you could share with us today about, from a lawyer's perspective, what people need to think about?
Yeah, from an employment law perspective, I think what the pandemic, to my mind, has done is underscored what was always true, which is that the foundation of good employee relations is communication. So whether you're cutting salaries to keep your company alive, whether you're implementing layoffs, whether you're helping people, assisting them to work at home or assisting them to come back into the workplace, talk to them. Talk to them about what's going on. Let them know. Right? Try and build a mentality where it's not you work for me, but we all work together. This is our business. This is our company. It's just as important, for you as it is for me that we make this work. So talk about what the issues are. Talk about what's going on. Talk about the struggles. Put a human face on the corporation. You don't just work for the faceless company. You work for a company that has its own struggles, and we're all in this together. And so we need give and take. That's what I've seen a lot. Like I say, many of my clients implemented very significant salary cuts and extensive layoffs. And the ones that have done that with the most success are the ones that just were open and honest about why it needed to be done. This isn't just so I can keep collecting the same money I've always collected on the backs of those who work for me. I'm taking a hit too. I'm suffering too. Let's all work together to try and get through this, so that when we get to the other side of it, we still have a company, you still have a job.
Absolutely, and that's I think reflected in all of your comments. Part of what I'm seeing is a lot of that. Organizations really are coming together and being able to find solutions together. And some of the most successful organizations that we work with really are the ones that not just direct what needs to get done, but ask the people who do the work, what's the best way that we can get through this, and actually intentionally listen to that too. Yeah. So that's always amazing. So thank you very much for sharing that. Marcel, we're at our timeline here for some of any questions that we may have. Do you have any to share with us here this afternoon?
Thank you, Dylan. Yes, we do have a few questions from the audience, and I'll pose them to you and you can distribute them as you like. But the first is, do you foresee any new health and safety risks arising as a result of this pandemic dragging on? Are there any issues we should begin considering now?
It's an interesting question. One of the things that we kind of glanced on a little bit earlier was that setting up work from home component, and I'll ask you a little bit about this, Dan, in a moment. But one of the things that we're starting to see now, we're now 8 months into a lot of individuals working from home that were used to working from home before. And what Manisha and Liz, you both talked about, was having those self-assessments, having those setups that individuals can look at and understand what does that look like. And we've provided advice to some of our clients around doing self-ergonomic assessments. But what we're starting to see now is individuals reporting repetitive strain types of injuries, issues, claims that are starting to pop up in organizations that haven't proactively done that. So I guess maybe a question for you, Dan, around that is there, you talked a little bit about the necessary equipment and whatnot. Is there anything else that people should be thinking about around what are other health and safety things that might start popping up?
Well, I think there's kind of two broad categories. One is people who didn't used to work at home are now working at home, and so there's the issues around that. Again, I think it's that clear demarcation between what is work at home and what is not work time at home, and the guidelines around how to set up an appropriate workstation so you avoid repetitive strain injuries. I have clients whose businesses have always involved workers who work primarily from home. Healthcare, for example, where it's home and community care. And so those types of businesses have policies, they have procedures. They even reserve the right to come in and inspect the employee's home workplace on adequate notice, of course, just to try and give guidance to the employees to help improve it. So your chair is too low and that's why you're getting the strains. You need to raise your chair up, etc. Now, that's a big thing. If you're suddenly visiting people's homes, particularly in a COVID environment, that's a lot of time, that's a lot of money, etc. So, we need to think about how we're going to manage that. And then the other side, of course, is the people who are going to continue to work in the workplace because there's nowhere else to do the work. If you don't do it at the workplace, it can't get done. And so again, we've got all of the issues about screening and appropriate distancing in the workplace, and who knows what the new recommendations may be as we learn more about COVID. So just again, keeping up on what the latest word is, what the latest recommendations are, and implementing those so that you're protecting your workers.
Great. So Marcel?
Yeah, excellent. Do you have any recommendations on how to deal with employees who refuse to wear a non-medical mask or face covering when required? In this case, the reason is not related to a medical condition.
I can take that. From an employment law perspective, certainly in Ontario, mask wearing is mandatory in all workplaces. That includes employees and includes guests and visitors and customers, et cetera. So to me, that's pretty straightforward. I think in that case, you maybe do go right to discipline. You are required by law to wear a mask in our workplace. If you refuse, you're not entitled to come into our workplace. And if you can't come into our workplace, you can't work and you won't be paid. So, with something as black and white as that, if I can call it that, I think it makes sense to take a harder line approach.
I'd like to
So I
add
know,
to
Liz,
that
you and I
too.
have had jump in, because we've had a bit of a conversation about the social side of some of this too. So.
And yeah, I'd just like to add to that, because sometimes refusal to wear a mask, it tends to run deeper so I think that you need to have some discussions around, yes, it's mandatory and these are the rules and you have to follow them, but also have some discussion around, well, why are you feeling that you don't want to wear a mask in the workplace? And making sure to help to guide that person to good, credible information about why wearing a mask is needed. And if they're still, obviously, if they're still refusing to wear a mask, then you need to follow the advice that Dan has given, but really trying to help to understand the why behind what may be behind it. And helping to provide information about the benefits of mask wearing, about how it actually prevents the spread of the virus, about the reasons why this is in legislation, because there are a lot of conspiracy theories out there, and there are a lot of people following these things. And so providing good, credible information and the reasons why the organization is following this, that it's not just, we're not just blindly following what the government is telling us to do. There's good, solid science behind this, and being able to provide that information usually will help to calm some of the fears and anxieties, and help to guide people in the right directions.
Yeah, that transparency of communication and being open and listening really is important again. So it's amazing how that seems to have been emerged as a theme through our conversation here today. So Marcel, do you have other questions?
Yes, 3 more right now. And thanks, Dan and Liz. This next one is a little different. What would you recommend is an acceptable office occupancy rate? Example, 50%. We have such an awesome office culture that we found it difficult to ask people to work from home.
It's a good question. So my first caveat is going to be that really depends on where you are. I live just west of Toronto here, and I can tell you that if I drive a half an hour east or half an hour west, the realities of COVID case rates are dramatically different. So I think that's part of dealing with that. Manisha, because you have operations literally on multiple continents, how have you really approached that in your organization?
Yeah, so in China, now when we have reports from China and East and South Asia, we're kind of envious because we want to be there too. But in China, we're sitting at 100% across our facilities. East and South Asia, it was a slow ramp up as well, but we did a staged ramp up, right? So we start with percentage of the population, and then to make sure we had adequate spacing, we would bring in, if you took a floor plan, we would do, A, B, and C, and those employees would be spaced out. You'd see them on a floor plan, and they would come in on different days so that we had adequate spacing throughout. So, across Taiwan, Singapore, South Korea, and Japan, we've slowly brought those operations back. But in Europe and across North America, we're probably still sitting at only 10, 15% capacity on site. And as things change, so we're watching the numbers every day. We're monitoring, cases per 100,000. And so we have when we start to see things leveling off, we know there's a period of time where we could start having the recovery discussions and talk about ramping up our plans. But we know that, Europe and North America, it's a different process. We're not getting the return as quickly as we see in Asia.
Yeah, and it is a challenge. It really is. I think part of going back to talking to your local health authorities, making sure that you're looking at what their guidance on these kinds of things, but to maybe switch the thought process as well. Having an awesome in-office work culture, is part of our organization. And a year ago, none of us thought that we could have 90%, 95% of our organizations working virtually. So maybe the question is how do we capture some of that work culture together in a way that we can do it virtually? I know with me, I've had more conversations with my extended family because I have family that lives in Newfoundland, Ontario, and BC. We meet on a pretty regular basis now, and I know more about what's going on in my cousins' lives and my aunts and uncles and whatnot lives these days because we're intentionally going out and doing that. So maybe there's that opportunity to thrive some of that work culture that you're missing today too. Marcel?
Great. Yeah, I'd like to squeeze in both of these questions if possible.
Okay.
When an employee tests positive, how would you inform the other employees about it without issues arising from it?
Dan, do you want to take this one?
Sure.
Touched a little bit on it earlier.
Again, this is another very context-specific situation. The starting point should be to do whatever you can reasonably to avoid disclosing the identity of the particular worker who's tested positive. Privacy law requires that you not disclose the information unless there's a proper basis to do so. One simple way to deal with it is to ask the employee who tested positive, are you okay with us saying that you tested positive? Many of my clients have found that employees are okay with that, particularly as the pandemic drags on. There's maybe a little less stigma than there might have been at the beginning. So if you can get the employee's consent, you're good to go. If you can't, as I say, you just do your best not to identify that employee. And, as I said, in some workplaces, it'll be easy to figure out. But really, there's nothing you can do in that situation as long as you've acted reasonably and carefully to try and protect the identity of the worker. You hopefully should be okay under privacy law.
Perfect.
Perfect.
One last one there, Marcel.
Yeah, last question, and thank you guys so much. What is a good support to give workers who may feel embarrassed about returning to work if they have had a probable or positive case?
So Liz, is there anything that the Mental Health Commission of Canada has put together to help with those kinds of supports and and dealing with that issue?
Yeah, I think that it comes around back to that whole stigma issue, right? So as people are coming back into the workplace, there may be fear from others for that person coming back in. And we heard that especially in the healthcare community, where employees were coming back in and saying, well, my doctor has cleared me, I'm fine to come back, but other employees did not want to work with them because they were afraid. So again, it's having those discussions. Okay, it's a return to work discussion, preparing others in the workplace for the fact that an employee who has been off with COVID, who has now been cleared, is cleared to come back to the workplace. We still have all of these precautions in place to try and prevent the spread. And let's remember that there's also a mental health impact to this. So let's get together and support each other on making sure that the rules are being followed and that any accommodation issues need to be addressed. So whether there's any, you know, gradual return to work or anything like that that needs to be done, or any other sort of accommodation, there's tools available to help with that. And again, if you look at the tools that we've provided in the resources section, there's a lot that can help with that.
Fantastic. Thank you.
That's all the questions we have time for. I really appreciate our panelists sharing their expertise and everyone who attended today. If you think of a question later that you'd like answered, our panelists' contact information is on the screen now. Thanks for tuning in for this webinar. We really appreciate it. Have a great rest of your day.
Thanks, everybody.
Thank you.
Thank you. Bye-bye.